When we last left our ICUBA family, Jane was about to get some troubling news. Jane just learned that she has been diagnosed with breast cancer. And while Jane was known as being a caretaker in the family, it was now her turn to have someone take care of her. The news was overwhelming, and Jane didn't know what to do until the phone rang. "Hi Jane, it's Nancy Stewart from Dr. Campbell's office. I was told the results of your mammogram. How are you feeling?" Jane couldn't believe it. It was her doctor's office, which just happens to be certified as a PCMH. You may have heard about PCMH, which stands for Patient-Centered Medical Home. It's like having a home base for your healthcare needs. In this model, Jane's primary care physician serves as a care coordinator for her by organizing and managing care delivery, disease prevention, wellness, and adhering to treatment plans. The result is better, more personal care, as Jane's doctor is in tight with other specialists, and together they know Jane's entire health picture. In addition to extended office hours, the PCMH physician office must also utilize an e-prescribing tool with decision support. ICUBA members have access to the industry's largest PCMH program in the state and nationally through the Blue Cross Blue Shield system of plans. Our PCMH program recognizes and rewards primary care physicians for delivering high-quality care and excellent service to our members. I'm a little scared and not sure who to talk to. Jane, this would be a good time to check your EAP benefits. I have used a nice counselor from MHNet, and I think I'll give her a call. Okay, Jane, that sounds like a great idea. I know you probably have a lot of questions, and I want to help you get through this. Why don't you drop by when George gets home from work, and we can go over your results and what steps I see you taking. Thanks for helping me. Is there anything else I can help you with today? Actually, I know that George is running out of his blood pressure medicine. I'll have the doctor take care of that. Fortunately, with Dr. Campbell being a PCMH, he does e-prescribe, and because Catamaran participates, he can view ICUBA benefits and formulary online. So Jane's doctor reviewed her records and got her scheduled to see a top cancer specialist who happens to be a part of an accountable care organization. An accountable care organization, or ACO, is a group of physicians and hospitals that work together to coordinate care and deliver quality-based outcomes for a population of patients. Compared to a patient-centered medical home, an ACO can be seen as a medical neighborhood. These programs are patient-centered and are comprised of hospital systems, independent provider groups, and multi-specialty groups. Here's how it works. Our ACO links with our best-in-class doctors, specialists, hospitals, and other healthcare service providers. They partner together to form a personalized service team to focus on you and your unique healthcare needs. And all of those people know exactly what everyone else is doing. That means they know what Jane's treatment plan is and what her total health goal is. Plus, everyone is looking at the same test results, which means everyone is seeing the big picture. What this means for Jane is that she doesn't have to shop around to find a doctor or specialist to treat her. The legwork is already done. We even help schedule appointments to fit her schedule and follow-up phone calls to make sure Jane's health is on the right track. And since everyone is working together, including ICUBA's dedicated case manager, Kathy Mann, Jane gets a clear and concise picture of all of her healthcare needs, which lets her focus on getting well. Jane is relieved that someone she can trust is really looking out for what's best for her. She's all set with getting the right treatment and can't wait to work with her healthcare team to get back to her old self.